Good afternoon and welcome to another GotSafety webinar presentation. I am one of the co-hosts, Rick Roman.
And I am Michael Crowley.
Michael, welcome to what seems to be the never-ending saga of COVID-19.
This is going to be one heck of a webinar, Rick. This is the never-ending sagas of COVID-19. We are bringing you information brought to you from the great Gavin Newsom of California, has come up with some more guidelines than put on the face of Cal OSHA, and we are proud to be able to tell and explain the beauty, complexity, and the frustration nature of these new things. Rick, this is going to be great. Right, Rick?
Yes. Let me go ahead and get my screen sharing going here right away.
Got to do
and
it.
That way we can.
Yeah, this is going to be great.
There we go. So we are talking about the second readoption to the emergency temporary standards known as Title 8 3205.
Man, they love that title.
And so as we look here, on December 16th, the Occupational Safety and Health Board decided to readopt for the second time the COVID-19 prevention plan. This is set to go into effect that'll be next Thursday, January 14th, and expires on April 14th.
My gosh, Rick, that is a short time, isn't it, Rick? You wonder if it's worthy of our time to put into place to make all these adjustments just for that short of a time.
It does make it kind of tricky, yeah. I mean, and this is pretty complex, actually. Some of these changes that they've made here, and to think that yes, we're doing this for 90 days, but the reality is when this COVID plan first even came into effect in December of 2020. It was set up to where they could have up to 2 readoptions of this, and now we're in that second one, and this was supposed to be the last one that could happen. But as soon as they passed this one, Governor Gavin Newsom issued an executive order paving the way for a third possible readoption, which could go as long as December 31st.
You know what they say, Rick? Third time is the charm, Rick, on getting it right. You know what I mean, Rick?
Well, kind of tells you this will be over when they tell you it's over, doesn't it? Because
it really does. Now, just know we don't take any political natures either way here. We are totally unbiased here. It's just the amount of things that you're going to hear in this. We want you to know this is all real, what the code is, and we're going to explain to you how this works. And we want your patience with us. I know some of you guys will be frustrated. We may have a few that are excited about new regulations. Most of us are not, but we're here to explain them, and so this will be good, Rick.
Yep. So as of right now, like I said, this stuff, the current regulations are still into effect. So that's what we're operating on until next Thursday, at which point the new regulations take over, and for at least the next 90 days, unless they either pass something that's permanent or readopt a third extension of this. But so when it comes to COVID oversight, there's a lot of different people who have their hands in the pie, right? You've got the CDC, which is not really they're not. They don't enforce. They're not the ones who make the regulations, but they do make a lot of the recommendations that these other agencies base their regulations and so forth off of. Then you've got OSHA. OSHA is working on, I'm sure pretty much most of you have heard about the mandates for mandatory vaccines for companies over 100 people. That had a stay that went on for a while. Next thing you know, we heard recently that nope, the stay has been killed and it was going into law. I believe it was supposed to go in on the 9th of this month, and now it's tied up again in the Supreme Court. And so we're not talking about any of that today. When we finally get what's going on with that, we'll hold another webinar and let you know how those things are going to affect us.
They get to see us again, don't they, Rick? They get to see us all over again for that, right?
Yes. So that's a whole nother set of issues. And then you've got the Cal OSHA issues. And then, of course, you've got the California Department of Public Health, which is broken up by the different counties, which have their own regulations. And sometimes some of the Cal OSHA code defers to the Department of Health. But the reality is that some of the recommendations or regulations amongst these different people, they don't always jive. And so some of them overlap, some of them contradict. And so today we're talking about Cal OSHA, the new 3205 regulation.
Yep. You're right, Rick. Let's get into it.
All right. So when it comes to who this applies to, went one too far. When it comes to who this applies to, just like it's been, this applies to all employees at places of employment with the following exceptions. People that work at locations with one employee who does not have contact with other persons, employees working from home, employees with occupational exposure as defined by Section 5199, which is the aerosol transmissible disease programs that are done for basically people in the medical industries. And they may have different guidelines and that they will go by. But even in those, Michael, if your company has an aerosol transmissible disease, you got to make sure that you're familiar with that program and understand that the guidelines of that program do not apply to all of your employees. So employees that do not have contact with patients are going to fall under the Cal OSHA regulation, which may be totally different than what you have going on with the aerosol transmissible, which defers to the county codes. I know a lot of people are asking, Michael, about, well, what about the new 5 days that they're saying? Well, that's the CDC's recommendation. That is not what is in the OSHA code.
Just recommendation.
Yep. So if you fall under the OSHA code, unless you're under the aerosol transmissible, and if your county happens to go by that recommendation, then that's what you go by. But everyone else, you're going by the OSHA code.
And just to make sure, Rick, we're talking about on the screen here, these things that you've just read, these are the things, A, B, C, and D these are the things everything we talk about does not apply to the people that are covered under this 4 areas. Correct, Rick?
Correct. So yes. And the last one being people who work telework, people that are working from home or a location of their choosing, not, controlled by their employer.
A lot of that happening. People working from home, doing a lot. We're next to a building that used to do a lot of in-house stuff, but they sent them home.
Yep.
A lot of that. Definitions, Rick. I love the section of definitions. Let's get down to it, Rick.
Yep. So now talking about the actual OSHA regulation that we're dealing with here, Code 3205. So they've changed some definitions to some things or made some things a little more specific. The first being the work site. It now specifically excludes the employee's personal residence, locations where the employee works alone, and remote work locations chosen by the employee. There's that change in what defines a work site. When it comes to a COVID-19 test, it now includes specific instructions for workers using an at-home test with self-read results. The employer or a telepath professional must observe the test results. And we'll talk a little bit more about that. As well as the face coverings, and it was updated to include more specific detail on the types of acceptable face coverings. And then the last one being fully vaccinated now mentions the minimal amount of time that workers need to wait between the first and second shots. And so they've changed some of the definitions on that, and we'll get into some of those as well. So if we go here, so when we're talking about some of the regulations that have been updated, so the first one, Michael, employers, as they always have to establish, implement, and maintain an effective COVID-19 prevention plan that includes identifying and evaluating employee exposures, implementing effective policies and procedures to correct unsafe and unhealthy conditions, and allowing adequate time for hand washing and frequent cleaning of touched objects. Care to elaborate a little on that?
Well, in those 3 areas, Rick, those really sound like things that were already in the code, right? I mean, who thought that we didn't need to give people time to wash their hands? That's insane, Rick. How is this new?
So that's not new. Okay. So what's updated is the fact that because that you have to have this program, and we hope most of you should, if you're clients of ours, obviously you've already got that.
Right.
But even if not, hopefully you have it. This has been going on for over a year now. But nonetheless, an update has taken place where the code itself has changed. So you now have to update that written program.
Right. So those things, you got to make sure we're doing these things. And I totally agree with you, Rick. All right.
And of course, if you're a client of ours, we've already made those updates. We've got all the new programs written, but when are we supposed to be getting all that put in place and uploaded, Michael?
We've got our team working on this. We should be able to get it all in place next week. The code pops next week, and we're going to have it all up for you next week. And that's the point to this. We want to make sure that you know some of the things that we've got going on. There's a few details that they're putting out there, and it's going to get a little kooky as we get further into this with some of these things. We're not trying to be sarcastic to put this code down or anything. What we're saying is it gets a little weird out there. So we're starting with the basics. You want to make sure your guys have time to wash their hands. Do that. You're evaluating the areas that you are, and that's what we're starting out with, the basics.
Yep. So by next week, you'll be seeing those in your client centers that'll be updated for you and everything. But we got to wait till it actually comes into play. And then the next thing, obviously, you got to continue to provide effective training to your employees. Yep. We've updated our management lesson for COVID-19 so that your supervisors and managers will know of all of these new numbers that we're about to throw out to you and what their responsibilities are and what has changed. So we got to make sure that we continue to train the employees. And then when it comes to investigating and responding to cases in the workplace, well, that's already been in place. But what has changed is because of the definition of what a workplace is, the people that you are obligated to notify, as we've had to been notifying for a year now, within 24 hours, anyone that's been exposed. Well, now with the new definition of workplace, it may or may not change who at your company you're actually having to notify. And then when it comes to screening of employees, you're still going to have to either, whether you're screening your employees or whether doing self-screenings, you're still required to screen employees before they come in. But what has changed is in the second adoption of the program, they allowed people who had been vaccinated, that if you were doing testing with a touchless thermometer to allow them in, that masks were not required. But now it says if the employer conducts screening indoors at the workplace, the employees shall ensure that face coverings are used during the screening by both the screeners and the employees. And if the temperatures are measured, that non-contact thermometers are used. So if you're screening, regardless of whether people are vaxxed or not anymore, you're still going to have to, you're both masking.
You know, we like to look at it and we're told that these masks were going to stop us from all this. But the reality of it is now is it's difficult to be able to know who is vaccinated and who's not. And I think that's why they're just going across the board. And Gavin Newsom is putting into place and making OSHA do this where you masked or not, because all of a sudden it stops the employer for having to ask about cards and stuff and who's vaccinated. And so it's just kind of putting good, bad, or indifferent. It's kind of putting, Rick, don't you think that everybody is on the status? You have to assume they're all unvaccinated, right? That's really where they're going with this. I mean,
we're treating everybody the same now. That is absolutely correct. Vaxxed or not, we're still treating them the same in that manner. I should have mentioned this at the beginning. I see some people popping with questions about the slides to the presentation. Yes, as always, at the end of the presentation, the slides will be available for you to download, and as well as there'll be a replay for you that you can share and watch at your convenience. But let's move along here. Go ahead, Michael.
I was going to say, you really got to make sure that in your facilities, you're training them how they get it, how they work around it. And you really want to do an analysis of your work sites to figure out where the close contacts are, where everybody's going, where the clean areas need to be, where you're really doing a lot of cleaning, bathrooms, touching areas and that. And wearing masks is something that the California law just really, it's important to do, because you get caught in a spot where you have outbreaks at your facility, and it's going to make things very, very, very difficult over there. So when it comes to the testing, Rick's got his next slide up, a change in the definition of the testing of COVID-19. Rick, tell us more about that, brother.
So really the highlighted section there is really the key part, and what is the change is the fact that because when all of this started, obviously you had to go to a clinic of some sort to get tested. Now they have these at-home kits that you can use. So obviously any kit that is used, as it says here in bullet point A, that has to be authorized, including in an emergency use by the EUA and by the United States FDA.
Yep.
And so, it has to be administered with in accordance of the instructions. But the new part here is that for these home kits, that the employee cannot both self-administer and observe the results. So really, Michael, we're saying when you send an employee home, he can't call you back and just say that he did this.
I'm good.
Right.
I'm good. Yeah, he can't really do that. And so you'll notice the first sentence is COVID-19 test means that a test for the SARS-CoV-2 that is not both self-administered and self-read. So you can self-administer it, but it can't be then read by you. You have to have somebody to verify, a telephone health professional or the employer or somebody has to do it. And that is going to be the change, really. That's a simple one. Thankfully, Rick, that is the most simplest one to understand out of all this.
That actually is.
You can't just do it yourself and trust everybody that goes, yep, I'm good to go, man. That was good. I got it. We're good. No, you got to really have somebody else read it.
Yep. So that's what changed in terms of definition as basically what qualifies, right? But other changes related to the testing is that, again, with the second adoption, they allowed that if a vaccinated employee were to be exposed, that they did not have to be excluded from work or test. Well, that exemption has been removed. So now it's that we've had the removal of the exemption from fully vaccinated employees from the testing provision due to close contact. So now they have to test as well. The COVID testing has to still be made available at no cost during paid time to all employees, and you have to provide them with information related to benefits.
And let me just point out that once again, this code is making the equalization of the COVID, of the vaccinated, and the non-vaccinated. They're really bringing us vaccinated because Rick and I are both vaxxers. We vaccinated, but they're really taking us and saying, listen, vaccinated or not, we're going to treat everybody like they're unvaccinated. Now, good, bad, or indifferent, that's really the motto of this. And so I see questions popping up regarding, hey, what if somebody at home can do it? No, it's got to be a telehealth provider, right? I mean, this is a new one. I don't know how many times I've dealt with doctors over the phone. I'm just usually not that sick, but yeah, you got to have somebody else. You can't just have your mother in the other room or your wife say, nope, you're good, sweetie. No, that doesn't work like that.
Yep. So that's it for the
testing is simple,
related
right?
to testing. Now this one here, Michael, here's where things start getting a little wonky and funky. So,
Rick, I love the word wonky. You just don't hear that. There's just not enough times in life to use the word wonky, right? I mean, come on. This one is a favorite of mine because the people that go and we go to sports arenas and stuff. And, I was in Los Angeles this last week and I went to a Laker game and there's a lot of people with a lot of different masks. And my favorite masks are the very blinged out masks with all the gems where it is just a showpiece, right? There is no mask there, right? And I'm not criticizing people's masks, but Cal OSHA has picked up on this. And I love this first yellow spot. Rick, read this yellow spot. This is perfect.
So this is really what has changed when it comes to, again, the definitions on a face mask. So as it's been, it still has to be, a tightly woven fabric, at least two layers. But here's the thing. Woven. Fabrics that do not let pass through when held to a light source.
Ooh,
so now your mask has to pass a light test.
I love the light test, Rex. Let's hope you're not using a 40,000 lumen light to be able to burn through your hole in your mask, right? I mean, this is so vague to me. I get the light, and I guess there's reasonability, but I'm knowing that this code is only going to last us for a few months, and some of you guys are going to roll the dice and think, well, maybe I just won't comply, and I hope you don't go that route. That's why we're updating your documentation. We're doing this, but when you have your people come to these facilities and they're working there, and they've got some sort of that pull-up scarf thing that they wear, it's like a ski shield or something, and you put light on it, and it clearly is penetrating through it. that's not a mask anymore in the work area. And this could be cited very quickly. And the way I see it being cited, now let me tell you, we've seen no citations on this because it hasn't come out yet. But the way I see this being cited is you have some outbreaks. You've got accidents in your facility, maybe not even related to COVID-19, but the inspector's out there and you've got people walking through the plant with those basically, it's like a winter neck scarf that you just pull up around it and it's got camouflage or other, paintings on it or whatnot, patterns. That right there is going to be challenged by your inspectors, because if they pull out a basic flashlight and put it on there and the light is passing through, and let me tell you, I don't understand the word passing through. Glowing? Yes. I can put a light to the back of my hand and see glowing of my skin, right? But passing through is really going to be a vague word. And I'm telling you, you really want to make sure your people are wearing proper masks if you are going to get a CalOSHA visit. I mean, even without the visit, you want to make sure they're having, because the ridiculousness nature of this thing gives the inspector so much ability to stretch pass-through light.
It's very subjective.
And when you're in that hearing, trust me, the administrative law judge, the good people they are going to side with the inspector most of the time. They are considered the expert in the room, and it's very difficult to challenge that from an employer standpoint. So you really want to make sure the people that are doing I don't want a mask, but I'll do it for you, and I'm going to wear this weird one, we're going to have to get those people in line, or you could be facing some trouble. And that is really it. Rick, finish this up, brother.
Yep. So they did make an exemption at the bottom here where
an exemption.
If you have folks, and this is obviously going to apply to a much fewer of your employees, but if you have folks where maybe there's hearing impairments or things like that, where you're having to use the masks that you've been using that have like the clear plastic over their mouth so that we can lip read, they'll still allow that, providing that it meets all the other specifications. As long as everything else, they'll allow those in that case. So they have made the exemption for that. But then also they have it here, if you look to the left, it says employees who are exempt from wearing face masks due to medical or mental health conditions or disability cannot wear a non-restrictive alternative, must physically distance at least 6 feet from others and be either fully vaccinated or tested at least once a week. And note that the testing must be during paid time and at no cost to the employee. So if you've got folks, go ahead, Mike.
I was going to say, the exclusion that we're talking to, Rick, is it really about the hearing impaired only? I mean, is that the exclusion that we're talking about?
The first exclusion where we're talking about where if you got the plastic, yes, if you've got folks that for whatever reason that they're for communication purposes that folks are having to wear those, obviously light's going to pass through that. If everything else meets the provisions except for just that one part, they're letting it go in the case of where you're using it for hearing impaireds or whatever, where it's needed for communication. But the other piece that I just read is more for people who may have a medical condition that for whatever reason cannot take the restricted breathing that a mask might do for them.
Man, Rick, don't say that. That's tough. I mean, you say a medical exclusion for people that have restrictive airflow. Listen, we're all going to suggest that's us. I mean, good night. Everybody's going to suggest that.
I'm not saying who's medically excluded or not. What I'm telling you is that the OSHA code says that if somebody who is obviously they need some sort, they would need some sort of doctor's note saying that they can't take the restricted breathing, or I don't even understand the mental health condition that they're too claustrophobic and can't take wearing a mask. I'm not even certain what those restrictions would be. But if you're able to get a medical exclusion to not wear a mask, well, then you're not going to wear your mask, fine, but you're going to social distance by 6 feet. How you keep track of that sounds like another difficulty, but they're going to distance by 6 feet and then have to be tested once a week at the expense of the employer.
Well, in all fairness, I feel like I'm losing my ever-loving mind wearing these masks, but I'm a mask wearer. I want you to know I wear my mask wherever we go and all the places and stuff. Man, I feel like I need a medical exclusion. I'm going crazy wearing these things. All right,
I know. So there you go. So there's that part. Now we're on to the fully vaccinated.
Ooh, I
And
love this. Fully vaccinated.
Fully vaccinated. So here it says that it means that a person has documented a person's status 2 weeks after completing the primary vaccination. So that would be like the Johnson & Johnson, 2 weeks after getting your one dose of the COVID-19, or if applicable, at least the minimum required interval between the two doses. So if you're a Pfizer or Moderna person, at 2 weeks after you've received the second one, that person will be, and is documented, is considered fully vaccinated. Of course, the vaccines have to be approved by the FDA or listed as emergency use by the World Health Organization, or this is kind of a funny one here, administered as part of a clinical trial if the recipient is documented to have had the primary vaccination and not the placebo.
Ooh, Rick, I don't think that's going to cover too many people. I don't think many of our people are in clinical trials. I don't think it's bad to go into one. I've just never gone in and felt the need to be a clinical trial guy.
So those are the three things that say what a good vaccine is. So the first one, 2 weeks after getting the first shot, or the 2 weeks after the second shot. Now the third part is a new piece, because they've allowed to mix the doses. Let's say you had the first shot was a Pfizer, but for whatever reason, your second dose wound up being a Moderna. I didn't even know that was a thing, but apparently you can do that. But then the restriction is that the second dose cannot be received any earlier than 17 days after the first dose. And then, of course, 2 weeks after that, they'd be.
So you're saying, Rick, we can make a cocktail of these things. We can do a Pfizer and Moderna. Somebody's got to come up with a great name for that cocktail. Like if you get one first, it could be like the bath on the beach. I don't know what it is. I don't know.
I know you don't want to go the soda route, because when you did that with sodas, I think they called them a suicide, right? And I don't think with this we want to go with that name. That's not going to be a good one.
Of that, Rick. We know that you're from the 70s with a term like that, Rick. Listen, that term we don't use anymore. But you're right. They're even allowing you to mix these, and I know people do it. Rick, what are we? Are we Pfizer guys?
No, we're Modernas.
Are we Moderna guys?
We did Moderna.
I know. This is sad. I'm not even sure. I just got the shot. Listen, I'm a vaxxer. I get vaccinated. Listen, to me, just poke me. I'm okay. Listen, when God wants me to come home, I'm coming home. That really is it. I love exclusions, Rick, because we see this big page of exclusions, and we all think to ourselves, man, we hope I fall into the exclusions. How do I get into the exclusions, man?
No, this is the exclusions you don't want to be a part of, because this is the excluding people from work, not excluding them from complying.
I know, Rick, but you got us all excited with that exclusion.
Yes.
Buddy. We all got excited to see this big thing of how we are excluded. All right.
And let me just tell you, you thought that the regulations prior to this were hard to keep track of and crazy. I mean, you better buckle up, because these numbers are mind-boggling, and I don't know how you're going to remember them, other than that each time you have a case, you're going to have to refer to this code to see where these people fall and what are you allowed to do with them. Because let's take a look here.
Rick, if you don't mind, rotate our picture up to the other corner. Is that okay, Rick? Who's doing that? Is that you?
Haven, move our picture up, if you will.
Flip us over there, Haven. Thanks, Haven. And that way we can see him. So you may, and we're going to send the slides out, of course, right,
yes.
Rick? But you may want to just snap with your phone this screenshot, not just to get me and beautiful Rick on the screen of your phone forever in eternity, but to really get this shot of it as we go over it. This is something you may want to reference to and share it with some of your friends. Rick, go ahead, brother.
All right. So it says employers shall exclude from the workplace employees who have had a close contact until the return to work requirements are met, unless one of the following exceptions applies. So people are going to have to be restricted from coming to work unless the employees who were vaccinated before the close contact and do not develop COVID-19 symptoms do not need to exclude if they wear a face mask and social distance for 14 days following the last date of that contact.
Rick, now give that again, guys. Now remember, this is what with getting rid. I mean, your employees can't come to work. Rick, give it to us again.
Yeah. So this is the guy or gal who was exposed to somebody with COVID-19. And they're previously vaccinated. They're not showing symptoms. So, of course, they've gone and gotten tested and they were negative. They can now return to work. So they can you can choose whether you're going to let them stay at home for the 14 days, they can come back to work, but they have to mask and social distance for the 14 days since that last date of the close contact.
And that's assuming that you have social distancing opportunities at your workplace,
yes,
right, Rick?
Right. If you don't, then I guess you're going to have no choice but to leave them at home. But yes, of course.
Okay. That's number one.
So the second exemptions are people who return to work and have remained, it says COVID-19 cases who have returned to work and remained COVID-19 symptoms free and they also do not need to be excluded for 90 days after the initial onset. So basically now we're talking about an employee who previously contracted COVID. They already stayed home. They got better. They've returned to work. And now for 90 days from when they first were either obviously the first day they had symptoms or whenever they tested positive. So for 90 days, basically, that person has a get out of jail free card that says that if they are then again exposed, they can either quarantine at home for the 14 days or, as Michael said, if an opportunity for distancing is available, they can come back to work, but they again have to mask and distance for 14 days.
Wow. Now listen, if some of you are excited about the reference of Rick's Monopoly reference of the get out of jail free card like I am, I love that. More people should play Monopoly in this life. But I'm saying to you, if you're also looking at these things going, man, Rick and Mike, they write these paragraphs crazy. Okay, just know. They're written crazy because they're done by OSHA. And so we are just cutting the snippets of this and putting it in the slide. So when you guys, man, your wording isn't great. Trust me, we're not doing this. I just want to throw that exclaimer out there, Rick, as we go through these. It's like, what the heck did you just read? I mean, it can be kooky, all right?
Yes, so that's why I'm trying to explain some of them so hopefully you get a better understanding. So the next one is for a COVID-19 case, and it's really almost the same as number two. This one's another person who had COVID, has returned to work, but that person never developed symptoms. So maybe somebody that they had gone in, they got tested, they were positive, they never had symptoms, but they were positive, so they stayed home and now they're back. So again, now that guy, because he or she had the COVID, basically has the antibodies for the next 14 days, and therefore that person can also come back to work. Again, they have to distance and mask for 14 days following that last exposure. So number two and number three are almost the same. Those are for people who've had COVID that have returned to work, and basically, regardless of whether they had symptoms or not, they're able to come back. So those people are folks that would not have to necessarily quarantine. Now we're talking about your regular folks who have not yet vaccinated and they get exposed. Persons who have had. Go ahead.
Let me stop you and just say this. Remember this as we read these things to you. They are not necessarily the CDC guidelines. This is where the confusion with all of COVID makes people crazy. I can see people in the chat room. I can't watch it all the time, but I saw a couple people ask, man, is this CDC? Because I thought it was 5 days and I thought it was this day. Just know what we're talking about is only the Cal OSHA regulations that yours truly, not me, maybe I didn't say that right, but Gavin Newsom put in play to make you feel extra special. This is what Gavin Newsom put into it. This is what's happening for the next few months. So just know that. This is only Cal OSHA. CDC are guidelines. This is, you don't do it, you're going to pay a price, a financial price with your business. This is what it is.
Exactly. Okay. And again, if you're in the medical industry where you have an aerosol transmissible disease, you're not following necessarily these guidelines. Correct. You're following the guidelines of that program, which may coincide with that 5-day CDC recommendation based on your county. But we're talking about Cal OSHA. This is what is going to apply to, I would say, probably 90% plus of the employees in California, right? They're not in the medical industry. They're not working from their living room. They're working at a place, and these are the rules that you got to follow to avoid, as Michael said, getting penalized financially.
And Rick, this really has to do with construction too in California, right? Even on job sites that are out there, this has to do with it. So just because you're a landscaper and you're at some sort of house in Beverly Hills and you're just out there, don't think that you're excluded, man. No, you are under the same things too. So there you go.
And I've glanced at the comments a few times myself and saw people asking about, it doesn't matter how many employees. The first slide I went over, one of the first slides was who this applies to. And unless you're working from your living room or from someplace where you have no contact with other people, or or you're under the medical guidelines, the aerosol transmissible, we don't care whether you have 3 employees or 3,000 employees. This applies to you.
And when you're running a business in the great state of California, the Cal OSHA guidelines we're speaking of do supersede the recommendations of the CDC. The Cal OSHA guidelines we're telling you today supersede the CDC guidelines, just to be clear. All right, Rick, give us the next part of this. Persons who had.
Yep. So for persons who've had contact. So again, now we're talking about folks who have not previously had COVID. We're talking about folks who have not previously been vaccinated. So those persons who had contact but never developed symptoms may return to work after 14 days have passed. And I believe it was 10. So now it's 14, and your CDC saying 5. But if you haven't been vaxxed, you have to stay home for 14 days since the last contact, unless either A or B applies. So 10 days have passed since the last close contact. The person, so now they can either stay home for the full 14 days, or after 10 days, they can return, provided they follow those same regulations that the other folks had, which is mask and distance for the remainder of what would be 14 days. So that means you're going to stay at home for 10, and for the next 4 days, you have to mask and social distance. Yep. Or then B, 7 days have passed since the last contact and the person tested negative. So if your test was negative and you've spent 7 days, now I don't have to wait the whole 10 days because I got a negative test and 7 days has passed. So I can now return to work again, wearing a mask and distancing for the remainder of what totals 14 days from that last exposure. And then, of course, persons who had contact and developed the symptoms cannot return until 10 days after the first onset. So that's kind of funny. If you're sick, you only have to quarantine for 10 days. But if you were exposed, you have to quarantine for 14 days. But
that is a tricky thing, isn't it, Rick? And let me tell you, this is a great time to pull out your cell phones and take a shot of the screen. Not that we're not going to give out the slides, but man, this on your phone, it is so confusing. We could probably read this to you 7 times in a row, and you still would be like, what the freak? 714? Who gets what? Who gets poked in the eye? I mean, you really are going to be in a spot where you are trying to remember all this. So take a screenshot of this. We'll send out the stuff. And
that is so true, Michael, because I must have read this 10 times, putting this together so that it could be clear in my head, so that when I have to talk to our clients when they're calling in and when doing this webinar, so that I could even keep it straight and you know, when you're trying to run a business out there and just do your day-to-day stuff, I just don't see how folks are going to remember. And that's why I say on a case-by-case basis, you know, you're gonna call us, or you're gonna look at the code to see how you need to react, because remembering these numbers are mind-boggling. 14 days, 7 days, distance, no distance. I mean, it's too much.
Vaccinated, not vaccinated. And the reality of it is, by the time you get this down, the regulation will expire and they'll have something else. I know it's enough to make you go crazy. So I guess the moral of the story is, keep us on your side, right? Use GotSafety. Isn't that really what the motto is? You think we were making this up, right, guys? I mean, you would think we were making this stuff up. I just, man, it's enough to make you go crazy. I doing this webinar and giving you this update is really important. We know that going on is the Supreme Court about Biden's push to make businesses mandate vaccinations. That's going to be coming out from the Supreme Court. We will do another webinar when that takes place. We have no opinions about it. Well, we do have opinions, but we keep those to ourselves, dang it all. And the reality is we are prepared to put into place and to do everything to make sure your documentation and the training and everything is ready for you. So just be attuned to that. When the webinars come on, that also will be one that you want to see and get the slides for, because that one could possibly be a doozy. Because as we know, when presidents put things into place, sometimes the Supreme Court says, I like that piece, I don't like this piece, and I want that piece. So they will break this up and do whatever they feel good about. And so we've got to wait for that and see how that plays.
Exactly. And you know, and you got to remember when it comes to a lot of this stuff too is coming out through your counties, and some of this, and that's why it's important to have that updated COVID plan that basically will let you know what things are deferred to the county, so that you can make sure that you're following their guidelines when you need to. But you know, this is what's going on right now. As of next week, this stuff will all be in play. And like Mike said, it's hopefully in 90 days. I'm sure they're going to either have a second I can't imagine they'll be ready for a permanent regulation. I don't see anything else other than them having a third readoption and some new changes.
I got the chance to go out this week to the field and see some of the clients. So if you are some of the clients I was able to go see, thanks for letting us come out. Some of us upper management taking a peek and see what's going on. I just want to reiterate this point to it that I noticed. Some of you in the field are still using the documentation paper model, and this is a tough way to go. I know that you're in spots where you don't get cell coverage, but our app now works off no cell coverage areas. You really want to download the documentation to an app and have this on your employees' phones if possible, or at least your foreman on the job, because the problem is to reprint these things from your office and send it out to all the areas to make sure it's up to date is literally very, very, very difficult. You want to make sure that you're using the GotSafety app. We have a customer service team in-house that will teach you how to do it. They will make it easy for you. Jana and her team are excellent at this, and there is no extra cost to utilizing our customer service team. Call in, unlimited technical support. We want to make sure you have all the tools you can have in your hand. So when you're out there and we go, man, a rule change. Well, I know the documentation is locked. There are lessons have been updated on this, and we are going to be putting it. So like Rick said in the beginning, we've updated the manager's lesson. So we have a lesson that's geared for your supervisors and managers that go over all this stuff step by step. It's in our GotSafety app. That's why we have it. And this kind of creation of content is really what makes us king. So some of you will think, oh man, there's Mike again plugging the GotSafety, but it's not. It's more than a plug. It's at this point, there is only one way to comply with this, and it's to have an online platform that changes as regularly, because you're out there doing what you do to make money and to be able to grow your business and take care of your family and all the other families that's tied to it. I just don't see how you're doing it if you're not having an online source that can have that readily available for you. Right, Rick?
Yep. I mean, it's a lot to try to keep your head around, and that's, you know, we've got folks that, you know, when it comes to getting this regulation and your documentation that do nothing but that spend all day studying the regulations and putting this stuff together so that you guys can just continue to run your business and rest assured that what you have is going to be compliant and that you're going to have the proper guidance. I've seen, like I said, a ton of questions coming through here. Unfortunately, we're not going to be able to answer all. There's a million of them, but Haven,
Rick, I'm scared. I'm scared of the questions, to be honest with you, because Rick, when you hear these questions, that I've been reading some of them, it's like your questions. Haven, give us some of the questions. Are you on board, Haven? Are you able to speak on camera?
I am. The biggest question I've had so far is, are the slides going to be available? And so right now, if you click on the files button that's on the left of the chat screen, you can be able to download those slides. Jumping into the questions, do we still have to pay our employees for 10 days if they get COVID?
You do. We're still having to pay employees. You have to pay them to go get, you have to pay for their vaccines. You have to pay for their time that it takes to go get vaccinated. You have to pay for their time to be off because they were ill or quarantining. They're getting paid for all of it.
Yeah, in California, you do. California loves their employees, so you're going to have to pay them. I know that you're excited about that. Business owners out there, by the way. What else you got, Haven? Let's move on to that question.
Answered most of the questions, but can we require a negative COVID test before returning to work? For for employees that have been exposed and are not vaccinated?
I would imagine.
I know one thing that makes that difficult. I know for sure is that the fact that even after you've had COVID and are symptom free and basically are cleared and good, you can still show positive for up to 3 months after. So for making somebody show a negative test is not necessarily the sign that they're negative and they're ready to go back. As far as the legality of asking them for it or requiring it, that, Michael, is that something more they probably need to talk to their labor law folks on?
You need to contact your labor law attorney, because really what you're talking, it crosses the lines of the Cal OSHA and the HIPAA laws and everything else. And we're not trying to skirt this issue, but it is an oddity. You want to say yes, and I do too, but Rick brings up so many points that it's you got to talk to a labor law guy, because what the federal government is doing that is, I'm sure, a concern to all of us, is they're utilizing the power. And I really think it's one of the first times in history on a workforce thing. They're utilizing the Cal OSHA system to enforce healthcare codes, and it is a workplace hazard. I get it, but in a lot of ways, it is making so people limit their personal choices. And I guess that's why it's at the Supreme Court, right? That's why it's at the Supreme Court. And we here at GotSafety don't take a political side. We just want to do whatever we can do to continue to do work and be safe and to make people happy. What else you got, Haven?
Can I enforce a vaccine mandate in my workplace?
Yeah, I love how you said Maxine update. I love that, by the way. We tease you, of course. The vaccine, Rick, forcing a vaccine update.
There are companies that are doing it. So what is being held up in court right now is whether the government has the right to tell you as a business owner that you must do that. But you as a business owner, of course, I would consult a labor law attorney again before doing it, can make your choices as and what the consequences might be of doing that. But I know that there are companies out there that do have vaccine mandates.
And Rick is right. There are companies that are mandating the vaccines, or you can't work for them. And I don't know any sort of court case right now across the country. And if there is somebody else out there I don't know every state's legal things going on, but I don't know of anybody right now that is suing a business or businesses are paying penalties because they enforced a vaccine mandate. I don't know of any that are falling into that. And I have heard some large corporations that will remain nameless that we deal with and have experience with in offshoot ways that are just saying, hey, if you don't get the vaccine by this date, then you are not going to be employed here. And this is a tough one. I'm proud to be able to say that my team that goes into the field are all vaccinated, that all my members of my company that go out there are vaccinated, and we want to be vaccinated. But that's just one you're going to have to call a labor law attorney on, because if an employee sues you, what you don't want to go is, GotSafety told me so, because we're not attorneys. I want to make that clear. We're not attorneys, so you need to contact a labor law attorney.
Yep. And I'm seeing coming across people asking about providing the masks for the employees. Yes, you still have to provide the mask. The company has to provide the masks for their employees. And now you have to make sure that it's a mask that passes the light test.
The great light test. Don't get the 40 billion lumen test, please. If you see the Batman signal of lights, right, do not hold the mask above the Batman spotlight for those guys. I'll do that. It's too strong.
And remember, I'm also seeing a lot of comments related to paying of the employees. Remember, people are asking, well, I thought I only have to pay if they got it at work. Well, yes, but now, like Mike said, it's getting so difficult to determine where somebody got it. Maybe we don't have any other employees that were sick. Well, maybe you have customers that come into your location, and so they could have gotten it from a customer. They could.
The UPS man.
The UPS guy. I mean, the burden is going to be on you as the company to prove that this guy did. I mean, he better have been on vacation for the last 3 weeks and got it a week ago, so we know that he didn't get it here. Other than that, I just don't see how you're going to be able to make a positive case that they definitely didn't get it at work, and then by running the risk of not paying them, it's going to cause you a lot of problems.
I'm also seeing a lot of questions about the size of companies these regulations apply to. Do they apply to companies of more than 100 or just smaller than 100?
Everybody except for the folks on, and you download the slides. It tells you who you don't have to worry about. You don't have to. If you got a guy that works in a building by himself that no one ever goes in or comes out of but that individual, no customers, no UPS man, no other employees. He's basically a hermit in there. Or if they work from home and never have interaction with other people, if you know, or working at a location and literally have zero. I can't even imagine how few people that would apply to. Those are the folks that this, or if you're in the medical field and you're under the aerosol transmissible diseases program, and for those employees, that's who this does not apply to. Everyone else, we don't care if you're a gardener with one helper or whether you have 1,000 employees, this applies to you.
Welcome to the party.
Yes. All right, I just got a few more here, but a lot of people are asking about like the LA Department of Health and California Department of Health have different regulations. Does Cal OSHA trump those as far as like the 14 days versus 5 days off?
They do if you don't want a Cal OSHA citation.
Yes. So those are the guidelines that you got to follow is the OSHA. Those CDC, not CDC, I'm sorry, those
LA County.
Those LA County guidelines, again, where they might be saying the 5 days, if in your aerosol transmissible disease in a medical, if it tells you to defer to your county and your county happens to be saying 5 days, well, then I guess you're following that regulation.
Okay. And then so since they have to pay employees time for testing, can they use sick pay to cover that?
Believe they're allowed to use whatever they can use sick pay. They can just one way or another. The employee has to be paid. That's what it comes down to.
Okay. And then the last question I have regarding pay is, what if the same employees keep using it, getting sick, and requesting time off? Is there a time limit?
We have found nothing to say that an employee that is repeatedly getting COVID. Let me tell you, if he or she is repeatedly getting COVID, I'd be a little suspicious, right, of these guys doing it. But I know people are getting worked like this.
Well, clearly the code has already made exceptions, or gotten rid of the exceptions for those that are vaccinated. So that already is telling you that, or people that have already had it. So that's already telling you people are getting this a second time. People are getting this after they've been vaccinated. So getting exposed multiple times and somebody may never get sick, but be exposed 10 times and have to quarantine every time and get tested every time. You're still going to have to pay for all of that.
Yep.
All right. That's all I got as far as questions.
All right. Well then, Michael.
Well, let me just say a few words before we leave the day. I just want to let you know that when you see these guidelines and you feel the frustration of them and the difficulty going through this pandemic, if you feel like, man, these are some nutty things, I'm just saying this to us. And I grew up in California, born and raised in Silmar, California, in the San Fernando Valley. Love that place. Love California beaches. I'm a California boy through and through. Let me just say, we should be active in our communities. We should be active with choosing and finding good politicians that support business in the state of California and doing these things. Too many times we have arguments and complaints that we have. We don't have those here at GotSafety. We just help you enforce the rules and try to make it so that they're clear and readable. But if you're a business that doesn't like what you're hearing today, there's only one thing you can do. Be an active, good member of your community. Talk to the local areas and really try to vote people in that you like. And I'm not suggesting one political thing or another. Our community, the great United States of America, is based on the public hearing their voices and taking their voices to the polls. And so whatever side you are on, and it doesn't matter to me, I just want to let you know I'm proud to be in a part of this great country, and I hope everything works out through this pandemic, and I hope everybody is safe, and I hope that your families are taking precautions, and if you do by chance get COVID, I hope and pray that you make it through it and everything is good. Rick, what else you got to say, brother?
Just like I said, with the amount of questions that we had coming through, if you've got something that you're that you're really needing to know, feel free to call us. We're happy to answer your questions. Unfortunately, I mean, due to time constraints, we can't get through. There's just so many questions with this, and we understand why. So, but we appreciate you giving us some time to come and learn about this, and hopefully, you know, we have some of the resources that can help you comply with this the best that you can and get through all of this. Like Michael said, we're just trying to we're trying to earn a living and do the best we can. And sometimes you need a little bit of help, and hopefully we can be that help for you.
My name is Michael Crawley, and this is Rick Roman, and thanks for coming to the GotSafety webinar. And we will see you possibly in a few weeks when we hear from the United States Supreme Court on the next COVID pop. Thanks, guys.
Thanks for coming. Bye-bye.
If you like this video, please follow us on social media for OSHA updates, free safety webinars, reminders on safety tips, tricks, techniques, and more. What are you waiting for? Like, follow, or subscribe today. Remember to stay safe out there.